Hello everyone, we're Group 3.5 and our presentation focuses on improving the healthcare needs of Prairie County. Before we begin on our plan on how to do that, here are some quick facts about Prairie County. The 7 towns that make up the county include Biscoe, Devall's Bluff, Des Arc, Hazen, Hickory Plains, Ulm, and Fredonia, with the county seats being in Des Arc and Devall's Bluff. There are 8,074 people living in Prairie County, and of that, 16.1% of residents are living in poverty. The per capita income for the last 12 months is $22,653. 86.3% of Prairie County residents are Caucasian, with the remaining 13.7% of the population being the following. 11.8% are African American, 1.8% are Hispanic or Latino, 0.4% are American Indian or Alaskan Natives, 0.1% are Asian, and 0.1% are Native Hawaiian or Pacific Islanders.
This graph shows the adult obesity in Prairie County, which is this red line right here. Arkansas, the dashed line, the green dashed line below the red line, and the United States, which is this dotted line. All 3 lines show a gradual positive trend indicating an increase in obesity at the county, state, and national level. Around 2009, however, the percentage of adult obesity in Prairie County surpasses the percentage of adult obesity in Arkansas. This graph illustrates sexually transmitted infections per 100,000 people in Prairie County compared to the rest of the state and the nation. There does not seem to be a consistent trend in Prairie County resident in terms of chlamydia and sexually transmitted infections, as we see in recent years that STI rates in Prairie County are well below the state and national levels. Preterm births, which is defined as a birth at least 37 weeks before pregnancy is completed, are a big issue in Prairie County. Ranked as the 6th highest county in terms of preterm births in Arkansas, the percentage of preterm births is 13% of all living babies born. This table from the Centers of Disease Control and Prevention shows the leading causes of death for people in Prairie County under the age of 75. Malignant neoplasms, which are also known as malignant cancers, cause the most deaths in the county, followed by heart diseases and chronic lower respiratory diseases. This table also includes age-adjusted rate per 100,000 people. Age-adjusted rates compare the population, which in this case is Prairie County, to a standard population, which in this case is the population of the U.S. in 2000. Age adjustment to a standard population eliminates the age distribution difference, which may cause data to show a certain disease to be more prevalent based on age groups. If the leading cause of death under age 75 in Prairie County were not age adjusted, the data could have shown that the top death was, for example, heart disease, without taking into consideration that nearly a quarter of the population in Prairie County is 65 years or older.
Now that we've listed health trends of Prairie County, let's look at this table showing how Prairie County ranks out of all 75 counties in Arkansas for various health categories. As you can see in the second and third row, Prairie County is doing well in terms of length of life and health outcomes, as they are ranked 4 and 8 respectively. The county is even doing relatively well regarding health factors, as it is ranked 33 in the state for health behaviors, clinical care, social, economic, physical, and environmental factors. However, it is ranked 48 for health behaviors and 65 for clinical care. For this reason, we create a program to target improving health behaviors and access to clinical care, which we will explain in depth in future slides. An important part of healthcare delivery is having health insurance. About 10% of residents under the age of 65 are uninsured. The line graph to the right shows that Prairie County has a large percentage of its population uninsured compared to the rest of Arkansas and the United States. Of the 89.6% that have health insurance, 33.7% are on employee plans, 22.9% on Medicaid, 17.7% on Medicare, 13.2% on non-group plans, and 2.13% on military or VA plans. Per capita personal health care spending in the county of Prairie County, Arkansas was $7,408 in 2014. This is a 6.91% increase from the previous year, which had $6,929 in per capita spending.
When researching for this project, we stumbled upon something crazy. There are no physicians living in Prairie County. The table in the top right corner shows that there are no physicians living in the county in 2017, which is pointed out by the black arrow. After reaching out to Prairie County health departments and the 3 clinics living in the county, we learned that there are 3 APRNs who live in Prairie County, 1 at each clinic. The Baptist Health Family Clinic in Hazen has 2 physicians who come out of town to provide health services a few days a week to patients living in Prairie County. The other 2 clinics in Des Arc and Hazen are named as Our Care Clinics, which offer discounted health services to Arkansans with or without insurance. In addition, Prairie County does not have any hospitals or emergency facilities, but according to their health department, people usually travel to Little Rock, Searcy, or Stuttgart for emergency services. The figure at the bottom right corner shows health professional shortage areas across the state. Prairie County is in the red with a HPSA score between 13 and 25. This indicates that there is a higher need of health professional services in Prairie County. The ratio of mental health providers and dentists to patients in Prairie County is 4,126 to 1.
The Affordable Care Act has played a major role in health and healthcare delivery across the state. One way that it has particularly impacted Prairie County is through the revitalization and utilization of community health workers in federally funded clinics such as the AR Care clinics. The PPACA pushes for a shift away from fee-for-service payment, and under new payment options are more opportunities to fund and sustain community health workers. Capitated payment models can give providers more flexibility to use community health workers because unlike fee-for-service payments, they can pay for staff and functions that have not been defined as reimbursable. Studies confirm community health workers' success in improving health outcomes among low-income and minority populations, specifically in chronic disease management, prevention of disease and illness, and insurance enrollment. While the Affordable Care Act Medicaid expansion provided large gains in health coverage and cost reduction among rural populations, it did not significantly impact access to care among rural populations. There remains a need to address opportunities to improve access to care among rural populations such as those in Prairie County.
The program we are suggesting focuses on 3 things: transportation, training, and encouraging students from Prairie County to pursue careers in healthcare. Our program would provide transportation to those that are in need of a primary care provider and do not have access to one. In the time that it would take to get the rest of the training program off its feet, the transportation would allow for people to have increased access to primary care providers that are located outside of Prairie County. To address Prairie County's aging population and a widespread primary care health shortage, the program we've created will recruit, train, and place healthcare professionals within this area. Also, we believe that mentorship from medical professionals and advice from recruitment specialists would be beneficial to educate students about the healthcare field. This would be done with the intention of encouraging them to pursue a career in healthcare and come back to serve Prairie County, rural areas with a health professional shortage, and Arkansas in general. Through these 3 points, we believe that this program would also help improve health literacy in Prairie County, community involvement in healthcare, community health, and increase healthcare access in this area. This program would initiate field placement for students from the 3 medical schools in Arkansas, nursing programs, and public health professionals to allow them exposure to rural medicine so they will be more aware of the different issues people in rural areas face or how to improve their health needs overall. This would increase the education access high school students have regarding health professional shortage areas, as well as potentially get them interested and involved in helping their community in the future. Also, we would establish a high school program where students could be a part of a healthcare track and graduate with honors in health. Basic requirements would include completing a certain number of volunteer and shadowing hours. After writing a 3-page reflection before graduation, they would earn a special cord for this track for graduation and receive a small college scholarship. In addition, we would provide yearly stipends to 1 medical student every 7 years who agrees to work in Prairie County for each year after they receive the stipend.
This is also an educational opportunity to potentially improve health literacy in the county. This program can work to recruit social workers to help uninsured residents set up insurance plans and conduct patient satisfaction surveys to help tackle concerns or issues they experience while working with the health professionals or students to help tackle issues that could affect their healthcare delivery or other important health factors. A provider, technician, or volunteer can help explain to Prairie County residents why it's important to, for example, check your hemoglobin A1C every 3 months if someone is pre-diabetic or diabetic. And this can provide opportunities for residents to take part in preventative screenings offered in the community. These services can help teach the community how to track their own blood pressure, blood sugar, have at-home breast exams, or even more, so that they can improve their health education and take control of their own health. We found 3 potential drawbacks to the program: cost, enormity, and increased competition. While a portion of our program would be paid for by taxes from the entire state rather than just from the county, people across the state may not agree with their tax dollars supporting this program because it would not directly benefit everyone. This program will require work from the Prairie County Health Department and other leaders of the area. It may be difficult to find several qualified people who want to run the program. We plan to address this potential drawback by recruiting people who have experience implementing educational programs in rural areas. Lastly, the 5 providers currently delivering healthcare services to Prairie County residents might see this as competition, which may mean less patients and business for them. We would emphasize education to overcome all of these issues.
To tackle the potential drawbacks we just talked about, these are 4 ways we plan to address them. To get funding for our program, we plan on contacting lawmakers to initiate incentives to help us procure funding for the program. In addition, we intend to apply for national grants to help fund our program. To attract other providers, we plan to offer monetary and residential incentives to help run the program. We would also offer educational seminars or town hall meetings to help residents understand the benefits of this program over the drawbacks. Thank you for watching.